as earlier on introduced, I'm Dr. Kalangwa from Ministry, Assistant Director, Health Promotion. I was given to talk about how to manage your relationships in the tight quarters during the lockdown. I think some of the things people have been asking is, do we have a lockdown? I think we've been hearing people bringing out a lot of questions. Do we have a lockdown? So if we look around, first of all, we are a landlocked country. So if we have most of the countries that are around us have locked down their borders, so we have a mini lockdown in the country. And it's important to state that measures have been put in place which limit movement. For example, we're encouraging people to stay at home, and also we're encouraging people not to go and attend events such as church gatherings, weddings. We've closed bars, and these are social places where people interact. So in this time, we have people's relationships which have been affected. So I'll go into the different categories of relationships. So first of all, I'll start with the element of social distancing, and also just mention that during this period, it's not an easy period in terms of coping with these measures that have been put in place. We are emphasizing that people should stay at home. People should maintain a distance of 1 meter. So as we are all aware, as human beings, we're social beings, and social interaction is one of our features. So if you look at the measures that have been put in place, for example, I'll start with the home setting. So family members. So you have, let's say, for example, people are watching TV. We're encouraging them not to maintain a distance of 1 meter, at least 1 meter in between them. So you find that affects their interaction. Then we also have friends. As I mentioned, we have people meeting in restaurants, bars, also other social gatherings that have been put on hold. So you find relationships have been affected in that direction. Then we also have personal relationships. I'll start with intimate relationships, husband, wife kind of relationships. So people have been asking, I think most of the TV and radio programs we've been doing, people have been asking, what are you encouraging people who are married in terms of their interaction? Since we're talking about social distancing, I think it has been stressed that for those people who are married, they still need to keep interaction. They need to keep on interacting and make sure that their relationships are kept and they keep on going. And also key is people have been asking to say, if let's say, for example, you have a relationship, a husband and a wife, one has signs and symptoms. They have cough, they are sneezing, they are having a headache. So we encourage during that time, when we're saying people should isolate, during that period, they're supposed to reduce contact. Because remember, before they are tested, we cannot actually tell whether this is COVID or it's just a normal flu. So you find we're encouraging people to say those who have no symptoms, they can continue with their interaction. For those who are married, for family members, we're saying they can continue with the interaction. They maintain social distancing. It's very key that people sacrifice. I think I must mention from the word go that this period requires people to sacrifice. If we're going to win the fight against COVID, we need people to adhere to the measures that have been put in place. I think also talking about friends, I think one of the things that I have personally I've managed to adhere to during this period is to see how we can maintain friendships via online discussions. So I chat with my friends via Zoom. I think I must say during this period, people have learned how to communicate using virtual means. And this is a plus. It's something that we think should continue. But during this period, when people are in tight corners, those who are in quarantine, those who are having symptoms, as they go in isolation, we're encouraging them to use as much of virtual communication as possible. I think for your friends, just because we're saying you shouldn't have contact, doesn't mean that you shouldn't reach out to your friends. So we're saying during this period, have more interaction with your friends. Uh, 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 you can do WhatsApp video calling, you can do Zoom meetings, have that interaction to make sure that relationships are maintained. As I said at the beginning, we are social beings. This COVID has an interruption of the social networking, especially the physical contact. Very important that you reach out to your friends, reach out to your pastor, give them a call. So I was saying during this period, I think we're encouraging people to continue with interaction. I think key things, as Dr. Dalaw has mentioned, is very important that mental health of people is maintained during this period. So we want people to continue with the relationships they are having. Just because we're saying we have the lockdown, people can't move, they can't go about the normal way, they can't go to swimming pools, but we're saying people should maintain the communication. So if you're having any challenge, talk to someone. If you're having any questions that you're having, talk to people. And we're saying during this period, try and see. I know there are different things that entertain people, and it's key that during this time, try and if it means watching movies, doing some home exercise, do some trainings, do some push-ups during this period. It's very important to keep you going. So just to wrap it up, it's very important that we manage our relationships. For those who are married, I think it's key that this shouldn't be an excuse for interaction. We're saying people should continue interacting. But as I said, if any of the partner has symptoms, it's very important that during that period, they isolate themselves and call the Ministry of Health numbers so that they are screened and tested during this period. So remember, it's very hard to differentiate the COVID symptoms from the common flu symptoms. I think that's what I wanted to share with you on the importance of managing relationships in the tight corners during this mini lockdown. Thank you.
Thank you, Dr. Thank you, Dr. Kalangwa, for a wonderful session. Thank you. So we have few questions from the participants. The first question from a participant is, has the rate of GBV cases increased or decreased?
Thank you very much. I think from the records so far and reports, we haven't heard of an increase in the rate of GBV cases. That's reported ones during this period. I think people have been cooperative, and from the reports that we're getting, we haven't gotten any increase in the number of GBV cases.
Thank you, doctor. The second question is, patients who are SARS-CoV-2 positive and have no symptoms are encouraged to self-isolate at homes. How feasible is this policy in overcrowded areas?
Thank you. So for patients, our country policy, for patients who are SARS-CoV-2 positive, all of them are being isolated in the hospital facilities. So we are not yet isolating them at home. So all those that test positive, they are managed from the isolation centers, and they are there till they test negative. So till they get discharged. As we are aware, about 30 have been discharged so far. And the criteria for being discharged is until they have 2 negative tests 24 hours apart. So when that happens, that's when they get discharged. So those who test positive are not isolated at home. But those who have symptoms, let's say, for example, someone comes into the country, those are encouraged to self-quarantine for 14 days. And if someone develops symptoms, let's say in the community, and they call the Ministry of Health numbers, when the samples are taken, during that time, they're encouraged to self-quarantine. When the tests come out positive, they are moved from their homes to the isolation centers.
Thank you, doctor. The next question is, in slums and ghettos, what strategies does the government have to ensure social distancing?
Thank you very much. I think that question has been coming very often. People have been asking about places like Soweto, the bus stations, the slums. How do people manage to maintain social distancing? I think the weight of encouragement has been going to promote social distancing, but I think one of the things that have been emphasized, so remember, social distancing helps to prevent the spread of COVID. Let's say, for example, someone coughs or sneezes, the droplets shouldn't reach the other person. So in places where social distancing is not very practical, we're encouraging people to wear masks. And the issue of cost has been coming up, the cost of buying the masks, as we are aware, most all our medical masks are not reusable. So they have to be disposed by the end of the day. So in such scenarios, we're encouraging people to use cloth masks so they can wear cloth masks, which help to prevent the spread of COVID.
Thank you, doctor. Thank you so much for your available time.